anatomy of HRCT temporal bone. So let's start our video with both. We need two views. First we need axial view and secondly we need coronal view. So first of all we will look at the things that we can easily see in the axial view. Okay, first of all we will start with the external ear. Here we can see the external ear is present. First of all we will focus on the one side, right side. Okay, I am moving the picture so that I can focus on one side. Okay, now we will focus on the right side of this patient. Okay, here, I will zoom it for you. Okay, now we will start our video with the external ear. Here you can see the external ear. Okay, the patient has wear some ornaments in her external ear, and patient age will be seen at this patient age. This is the patient age as Ajra, and above that age is written. Okay, the external ear, and here from external ear we will start looking inward. Here you can see that you are going inward to the external auditory canal. We can see the presence of external ear, its shape, its prominence, any mass, any deformity, no mass present. No focus on the external auditory canal as indicated by my arrow of the mouse. Yes, 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 you can see the external artery canal. Okay, we are going downwards, and here you can see the external artery canal, and the structures of the middle and internal ear have started to appear. We are going towards the middle ear. Okay, middle ear consists of tympanic membrane. When tympanic membrane will start appear, we will see that we are in the middle ear. Now we will locate the middle ear, and then we can see that we are inside the middle ear. Here you can see the tympanic membrane. The tympanic membrane is cleared and will rise very well. No opacification or any other thing can be seen in the tympanic membrane. And after the tympanic membrane we can see the internal ear and the internal ear structures. Okay, here you can see the internal ear and whole the apparatus. Okay, so the first bone to look for is the scutum. So how to locate the scutum? So we will open the anatomy in coronal view, and in the coronal view we first locate the ear ossicles, and the ear ossicles we will look for the incus, malleus, and stapes, the three ear ossicles. So this is the head of malleus, and when we see the head of malleus, the first bone with the sharp end is the scutum, as I have indicated with my arrowhead. You can see this is the head of malleus, and this is the scutum. You can see the sharp end. If there is any obscuration of the sharpness, or this is not visible, we can see that there is the degeneration or involvement of scutum, the cholesteatoma or cholesterol. So there is a space that is present between the scutum and the head of malleus, a very important space that gives rise to the formation of inner ear cholesteatoma, that is Prusak space. Prusak space is present between the head of the malleus, this is the head, and this is the scutum. So this structure is the Prusak space. This structure as shown by my arrow is the Prusak space. Okay, scutum, malleus, and this is the Prusak space. Okay, I think I have cleared it for you. So we will divide the we will basically divide it into three parts. Okay, the middle ear will be divided into three parts: the epitympanum, the hypotympanum, and the mesotympanum. Epitympanum, hypotympanum, and the mesotympanum. So we can draw an arbitrarily line from this. Okay, from this. Okay, from this to that, I will make that line for you. So here I have drawn this line. Okay, the structure above this line is epitympanum, and the structure below are meso and hypotympanium. Now we will again draw another line here. This whole is mesotympanium and this is hypotympanium that approaches towards the eustachian tube. Okay, epitympanium, mesotympanium and hypotympanium. I hope I have made things clear for you. Now the other things will be evaluated in the axial view. Okay, so now we will axial view for locating the inner ear. We will first locate the basal turn of the cochlea. Here you can see the basal turn of the cochlea very well. I will locate that for you here. Here too you can see the basal turn of the cochlea, and this is the vestibule, and the vestibule, then this agnet ring structure, this that opens into the vestibule is the lateral semicircular canal. This is, you can see the ring appearance of lateral semicircular canal, malleus, and the malleus below malleus is incis, and lateral semicircular canal, vestibule, and this is the cochlea. This is modulus of the cochlea. This structure, the modulus of cochlea. This structure, I will see modulus of the cochlea. Okay, and this is the inner auditory canal. You can see that. So lateral semicircular canal, this is vestibule, and above the vestibule this structure is the oval window. What is this structure? Oval window, vestibule, lateral semicircular canal, and this is oval window. So you will tell me which bony structure is attached to the oval window. We have learned in our ENT that the foot plate of stapes is attached to this oval window. I will make the view clear for you. Here you can see this is the foot plate of stapes and that is attached to the oval window. Vestibule, lateral semicircular canal. This is the posterior semicircular canal. That canal that is coming. This is the posterior. Okay. And now we will go with we will locate other structures such as round window and the round window neck. So we are locating the round window. Okay, here is the round window for you. I will scroll up and axial view. Round window, and above the round window we can see the other structures in that view. So we will take time and we will here we go. So you can see this is the round window and this is the prominence of the bone in which round window is present. Round window, and this is round window neck. Most likely necky, we see the neck. Above the round window we can see the facial nerve, but in this view we cannot see it much clearly. Now we will come to the coronal view. Scutum, head of malleus, incus. This is the prominence of the cochlea. This is sinus tympanum. This is prominence of the cochlea, and above the prominence of the inner ear or cochlea we can see that above is the round window, and above round window we can see the facial canal. Okay, This is the superior semicircular canal. This is the this is the lateral semicircular canal, and the both these semicircular canals combine to form ear vestibule. As seen that this is the ear vestibule. Okay, and here you can see the posterior semicircular canal. This is the posterior semicircular canal that comes and opens into the ear vestibule. Okay, and if we come downward, we can see these two arrowheads. One is the anterior end of the superior semicircular canal. This is the posterior end of superior semicircular canal. Here they unite with the posterior semicircular canal to form a crust that opens into the ear vestibule as seen in this picture. Okay, now I think the mostly structures are very well uh, explained in this video. So now come with the abnormality. You can see the complete opacification of the mastoid ear cells of the both sides. So this is a case of mastoiditis. Now we will look at the middle ear, either that is opacified or not. I don't think that there is a very marked opacification of middle ear, so this is a case of mastoiditis.